Good afternoon, everyone. I'll be presenting a case of Goldenhar syndrome.
Okay, continue.
A case of Goldenhar syndrome presenting with limbal dermoid. So a girl, 16-year-old student by profession from Gitcha, Uttarakhand, presented to our OPD with main presenting features of mass in right eye since birth, right-sided facial asymmetry since birth, and right ear deformity since birth. The lesion was progressive, painless, and she complained of foreign body sensation. Prior consents were taken for the disclosure of her identity for academic purpose. Personal history showed she gave no similar complaints in the family, non-vegetarian by diet, no history of any kind of addiction, and normal daily routine. She gave no negative history such as diminution of vision, diplopia, discharge, any kind of trauma, or any kind of ocular surgery in past. Examination was done. General and systemic examination was found to be within normal limits. Laboratory and radiological investigations were found to be within normal limits. B scan was suggestive of query-limbal dermoid with no intraocular extension. Ocular examination showed vision to be 6/6 in both the eyes. Right eye conjunctiva showed an orangish white mass of size approximately 4 into 4 mm, encroaching 3 mm of cornea temporally with hair on its surface, as we can see in the picture below. Rest anterior segment was within normal limit. Fundus in both eyes was found to be within normal limits. Oral examination was done, which showed grade 1 microtia according to Mark's classification. External auditory canal showed atresia of grade 1 according to VIDA classification. Pure tone audiometry could not be assessed, and low hearing ability was present in the girl since birth. So differential diagnoses were made to be dermoid, granuloma, conjunctival intraepithelial neoplasia, squamous cell carcinoma, teratoma, amyloid, or pinguicula. Final diagnosis was found to be right-eyed limbal dermoid with facial asymmetry, with right-sided microtia with external auditory canal atresia, suggestive of Goldenhar syndrome. Management was done with right eye limbal dermoid excision with corneal grafting under local anesthesia, and the mass was sent for histopathological examination. These are some of the post-operative day 1 images of the patient. As we can see, patch corneal grafting was done and sutures were found to be intact. Histopathological examination showed tissue showed to be resembled skin lined by epidermis. Subepidermal tissue was found to be fibrocollagenous tissue with adipocytes. Occasional hair follicles were found. Sebaceous gland, sweat gland, blood vessels, and few nerve bundles were found within, which was suggestive of limbal dermoid complex choriostoma. Post-operative medical management was done with topical and oral antibiotics, steroids, NSAID, supportive treatment. So, to summarize this case, this illustrates a mild penetrance of Goldenhar syndrome with primarily cosmetic problems. A multidisciplinary assessment of all such patients should be done to identify all the related and more severe anomalies. Prognosis is good in uncomplicated cases with minimal systemic involvement. Thank you.
Thank you. If you noticed some difference in her presentation? Any difference in your presentation and her presentation made? Yeah, the way of presenting is different. And she highlighted what is needed to be and very clearly understandable. Very nicely met and nicely